is the front, right? Anterior knee. If you're looking at the front of the knee, everybody, is this the right or the left side?
It's the right.
Yeah, because the fibula is medial or lateral?
Medial.
Medial.
Lateral. Fibula is always lateral, right? Yeah. Tibia is medial. So this is the fib. This is the tib. And then of course this is the femur here, right? One thing is, what would cover this, these condyles in a normal knee?
Ligament.
Articular cartilage, right? Yeah. What tissue type is that articular cartilage? Hyaline, yeah. Now, the knee, remember, it's kind of an unstable looking joint, right? Because you just have those two condyles. So you have to have some sockets here, or little valley cutouts that really hold the knee together. One, you'll have ligaments, and the other one is you create these little cups. These cups are called menisci. So you have this one here. That would be the, okay, is that medial or lateral if it's on the tibia side? Yeah, it's medial, right? The tibia is medial, the fibula is lateral. So this would make it the medial meniscus. And then on the opposite side, of course, that would be the lateral meniscus. Okay. All right, so that, again, that helps you just deepen the condyle so the femur can really sink in there, okay? And then you have these two ligaments on the sides. Okay, if it's on the fibula side, is that medial or lateral again? Lateral. So you're going to call that one the lateral collateral. What?
LCL.
Yeah. So it's called the LCL, lateral collateral ligament. Yep. And if you called it the fibular collateral, that's okay too. All right. But typically in clinic, it's called the LCL versus the F. If you say FCL, everyone's gonna look at you like, "What are you talking about?" Okay. But on the other side, that's called the medial collateral ligament. And what will the two collateral ligaments, what are they going to help to limit in terms of the movement of the knee? Yeah, so like the side-to-side movements, right? So let's just say the star there will limit, you could say medial lateral movements or side-to-side movements. Okay, makes sense? And then with a attack from the side, let's say someone is like playing soccer or football, which ligament will more likely tear? So what will happen is that if you get hit from this side, usually that ligament will just kind of fold, but then this will get stretched to the point of possibly tearing. Okay. All right, now let's go in there. It's really dark. So I'm just going to blow it up in terms of what you would see. If you see it on the practical, you're going to see one that looks this way, and then another one behind it. And notice how they form a little X or a little, what's called a little cross. A cruce is what it's called, okay? So the one in the front, this guy right here, is called the anterior cruciate ligament. Okay. That one tends to be a little bit shorter than the other one, than the PCL, so it's more likely to get damaged. Okay. And then the one behind it, of course, is the PCL, posterior cruciate ligament. functionally, what will they limit?
Forward and back.
Exactly. So limit forward, backward, or anterior, posterior movements.
So when you tear the ACL, does the posterior also get torn?
Not necessarily. Not necessarily. Yeah. So the PCL has a little bit more laxity to it, so the ACL tends to be a little bit firmer. So that one usually tears first. Can you tear both? Absolutely. Yeah. So they can go in there, and some people are walking around with a totally, completely torn ACL. Okay, knee braces, a very unstable knee. Anyone ever like damage your ACL before? You have. Oh, this is the horse accident, right?
I did 8 months before I had surgery.
Was it completely torn?
No, it wasn't. Oh yeah, it was.
It was completely torn.
Yeesh.
Okay. Wow. All right.
So you have to go through other like protocols. Like,
Yeah.
you know.
Yep. Makes sense for the structures. Those are the main things I'd like you to know. Let me just show you something real quick. Lisette, can you sit on that chair real quick? Can I demo something on your knee? No, we'll do reflexes eventually, but on the knee, your knee's healthy. Like, I'm not gonna lie.
Just your
So-
snap.
Touch your knee. So back and forth, it's really tight. So I'm testing her LCL and MCL, and then for the ACL, what you do is you basically hold the top of her knee, and then you pull forward her tibia. What happens? Are you okay? Rolling around. So what happens if the ACL breaks? You take the tibia, and you can actually feel the tibia move forward. Okay?
Ooh.
It's called a positive growth when it just keeps going. So hers is nice and tight. Thank you. You got a healthy knee. All right, let's go here. Oh, does this look familiar?
Oh.
Yeah, it's like a little wedding cake, right? You see the little wedding cake? Pretend you did this, and you took a little cut out of the cross section. Are you following me?
Yeah.
You took that guy and you blew it up, and it looks like this. Okay. Do you guys agree that this is, for the most part, what tissue type is up here?
Compact bone.
Exactly. In a few minutes, we'll look at the slides. I'll show you like skin and all that good stuff. So compact bone,
Compact bone.
compact, right? Now, if you're here though, and you are inside, oh, you can even see some right there. What tissue type do you see lining the medullary cavity? Yeah, so let's take the wedding cake and turn it around. And on the inside, you see it? What tissue type is lining the inside of the medullary cavity?
Spongy.
Spongy bone. And so this would all be like the medullary cavity if you use your imaginoscopes, yes? Okay. Now, right here, do you guys see how there's this gray, I'm gonna blow this up, but there's this like gray lining right there? Okay. Anybody remember that layer that lines the inside of your medullary cavity? It's not the periosteum, it's called the endosteum. Okay, the endosteum is for things like repair and growth. It has some stem cells in there. All right. Remember too, you can see some of these other features, right? Like, what is this one unit called?
Osteon.
Osteon. What was the center space called?
Canal. Central canal.
Central canal. Yeah. All right. Let's go back up to the top one because things are nice and big there. Do you see the double layer?
Yeah.
Yeah.
Okay. That double layer is actually, the whole thing is the
Periosteum.
periosteum, right? But that periosteum is actually made up of this outer part. And then there's also this inner lining right here. Okay. What is the outer layer called of the periosteum?
The outer fibers.
Yeah, outer fiber. So the periosteum. So here's the point. Periosteum, it's double layered. It's made up of that, which is the outer fibrous. And the outer fibrous will do what? It'll basically hold things like what? Blood vessels, nerves, yeah. Okay. And then there's an inner part. Anybody remember what the inner layer is called?
Inner osteogenesis.
Osteogenic. Very good. And the inner osteogenic has bone stem cells, right? So for repair and growth again. Where is this big old model anyway? Anyone see it around the room? Back there. So it's just hold it up first real quick. So yeah, there it is. Very taggable, yes? Okay. Okay, lastly, thanks Troy. There's one other thing that we see here associated with it.
Sharpie's fibers.
Yeah, these are called Sharpie's fibers. They will help to hold the periosteum to the compact bone. Sharpies, yeah, like a Sharpie pen. Sharpie's fibers. And they will
Anchor the
attach periosteum to the compact bone. It's very strong. It's hard to peel off the periosteum, okay? And that's a good thing, because if the periosteum were to peel off, there goes your repair and growth. There are some rare situations where the person fractures their bone, the periosteum comes off, and they don't get good healing, okay? All right, last couple things, and we'll do some slides. What if I asked you for the cells?
osteocytes.
Osteocytes. Was there a question? Attachment of the periosteum to the compact bone, right? Osteocytes, do they live in what space?
Lacuna.
In the lacuna. Thank you. I'm hearing that a lot at my house right now. What if I asked you the name for the, just in general, the layers? Lamella.
Lamella.
Yeah, very good. There's actually 4 types of lamella. I'm not going there. Concentric, interstitial, outer, and inner. Rah, rah, rah. Okay, that's enough. Okay, so lamella's good. Final thing is, I keep saying final thing, huh?
Yep.
Do you see how the central canals are interconnected?
Yeah.
Okay, so let's circle one of these connections.
Perforating canal.
Oh, very good. So those little connecting
Perforating
areas,
canal.
they connect the canals. They're called perforating or Volkmann's canals. So perforating or Volkmann's, they will connect
Blood supply.
the central canals to each other. Make sense?
Yeah.
That should be plenty to keep
I'll
you
make it
out of
enough.
trouble. You don't think it's enough?
Yeah.
Sure?
All right.
You need more.
Let me check my list. The knee, we did that.
Yeah.
Yeah.
Articulation questions. All right, we're on the slides. You guys want to do slides or you guys?